Joined now on Halton News by the President and CEO of Joseph Brant Hospital, Eric Vandewall. Thank you for your time, Eric.
Thank you, Jason. I welcome the opportunity.
Well, let's talk about the current state of the hospital and really the current state of the world. Now that kids are back in school, routines have returned, people are living unmasked in the world once again. What have we seen happen at Joseph Brant because of that?
Well, a great question, Jason. And I'd suggest we're seeing this right across the hospital and health system in Ontario and perhaps the country. And so as people start coming indoors more, public health measures have been lifted, as you know, higher probability and risk of becoming infected, be that with the flu and influenza, with COVID, and just other upper respiratory diseases that are very prevalent during the fall season.
So across the province and the country, as you mentioned, many are concerned about the care given in the emergency department. It seems to be the first and foremost when we hear about stats, because if someone gets sick, that's unfortunately where they end up. How is Joseph Brant as far as wait times go and dealing with the ongoing issue of staffing shortages?
Yes, so staffing shortages, there's a significant labor shortage right across the system in Canada and Ontario. Joseph Brant is not unlike any other hospital right now, so we have challenges every day, not in every department, but many departments. And so we're working with alternative staffing models that ensure that we can still provide the high quality care that we always commit to provide. And that's working fine. Our emergency department is really doing well. There's a provincial ranking system that ranks hospitals from 1 to 74, and that's on a whole series of things, Jason, wait times included. And we are currently ranked over the past summer months as number 5 and number 1 in the GTA. And so that's a real testament to not only the staff and the physicians in the emergency department, but in fact, right across the entire hospital, because in order to achieve that metric, every department contributes to making sure patients flow through seamlessly and in a timely manner. So I would suggest the organization's doing very well, but we're not without our challenges on a day-to-day basis either.
Now, one of those challenges that I highlighted last time and is an ongoing issue, not only at Joseph Brant, but everywhere, a stat that I read in your last newsletter is that there are 2,321 people waiting on surgery. And again, that's not the province, that's not the city, that is at Joseph Brant Hospital. That's a huge stat. And I'm wondering, what is being done to close that gap to get those people into surgery?
Yes, it's a significant challenge, not just at Joseph Brant and elsewhere. And as we know, a number of various lockdowns and public health measures essentially created this backup of cases. So things that we're doing, Jason, at Joseph Brant Hospital, one, we're taking a look at every opportunity to become more efficient. So we have a fixed resource in terms of number of operating rooms, number of surgeons, but also then number of staff to support the operating rooms. So how can we be more efficient? How can we flow more patients through? Are there ways that we can provide some of the services and procedures on a day basis versus an inpatient basis? And so we've really challenged ourselves from a practice perspective to push that envelope. Notwithstanding, we still have 2,307 cases as of today versus the update when I gave you as of September 30th. I think we were about 2,321. So we've made some progress, but it's an ongoing challenge and one that we're committed to trying to address as best as we can.
Yeah, and again, it's not just Joseph Brant. We're not just picking on the hospital. It's an overall challenge, Ontario, across the country, etc. And something that I think the healthcare system in general, is fighting against and really trying to play catch up. Eric, appreciate your time today. Thank you very much. I look forward to checking in with you in a couple months' time.
Jason, thank you very much. And parting comment, I'd encourage everybody, the listeners, to, if possible, please get your flu shot, get your COVID booster. Indications are based on the Southern Hemisphere and the winters in Australia that this season will be a very challenging flu season. I understand that the flu vaccine is a very good match this year. I'm getting mine next week. They say get them between the Thanksgiving. So I really encourage your viewers to do so to stay safe and be well.